In the last 5 years, we've grown from 1 owned hospital plus 1 managed hospital to 7 fully owned hospitals and 4 affiliated or managed hospitals. Plus, we have a hospital under construction anticipated to open in the summer of 2013 and another announced hospital. The volume of events that we're tracking has increased substantially with our system growth, our facility growth, and our employee growth. And having risk management personnel really tied pretty much into data entry was inefficient. And we really wanted to free up those staff members from doing data entry to using the business objects reporting tool to do tracking and trending and ultimately risk prevention. We also had a significant problem with timeliness in reporting of adverse events. So timeliness was probably the largest consideration in our decision to implement the general liability web form. Riskmaster X is the product that we use at Scott & White Healthcare, and it is web-based, which has been essential for us. Riskmaster X has allowed us to put risk management personnel in our regional facilities and not just at corporate headquarters. And we all have access to the same data and the same information, and we can really be proactive out there at each of our facilities. It allows really us to get real-time data from our frontline staff. When there's an injury or a potential injury to a patient or a visitor, we know about it just as soon as they hit the submit button. It's immediately posted in the Riskmaster database. And then also, because we're not spending time doing the data entry, we can very quickly turn around this data to the Scott & White leadership for risk prevention purposes. And we have required fields in our web form, so we're not missing that essential data. Today we have more than 13,000 employees for which we administer the workers' comp program. Riskmaster allows us to effectively and efficiently track all staff member accidents, and then ultimately, of course, that decreases days of lost work and costs. The total number of employees has more than doubled in the last 5 years. Also important to note that Scott & White Healthcare has, in the last several years, brought back in-house all of our support services. And that particular employee class probably has the most exposure or the greatest risk from a workers' comp perspective. So despite bringing back our support services in-house as well, our number of incidents as a percentage of employees has remained absolutely steady. So that's really demonstrative of how we're able to use the Riskmaster tool to track. It's all about having the data at your fingertips to track and to trend the staff member accidents. It is the ad hoc nature and the ability to create absolutely any report that we need to using business objects that allows us to do what we do as an effective risk management team. What we love about the Riskmaster product is that we can customize the fields, and so we can track absolutely any data element that we choose to. And so we can prove or disprove different theories for what causes adverse events or staff member accidents. Zurich Insurance Company in the year 2010 put together a benchmarking report comparing various healthcare systems across the United States. And what they found in that benchmark report is that for the same time period, we were really in the bottom quartile of cost lost per occupied bed equivalent for claims. Even with our growth in the most recent 5 years, that average loss cost per bed has gone down. We had a really good team that we worked with that were able to share their experiences working with CSC's other customers and to give some good back and forth and dialogue about how to design our web form, because it is not, for example, specific to nursing. Our web form for reporting of adverse events can come from absolutely any staff member in absolutely any department. In terms of technical support, those guys are the friendliest group. They're a knowledgeable group. And what I like about them the most is that they're really motivated. So if I call and I report a technical support issue and they can usually provide me a workaround pretty quick. But for most of them, a workaround isn't acceptable. They really want to know what the problem is and to correct it. and then as well some of the suggestions for improvement that have kind of come as a result of my discussion with the tech support people, I understand may well be incorporated into future versions.